34 more deaths. 21-day case average now sitting around 1,600.
Well, if you are not already overwhelmed with all the news about COVID, doctors are asking people to make sure that they get their flu shots, especially this year. 13 ABC's Melissa Veitch joins us with why it is so urgent. Melissa.
Well, Diane, you know, these two viruses are virtually identical. This is not a year when you want to be caught without your flu vaccine. You talk with doctors, and there's some major reasons why you don't want to be unprotected from the flu in the middle of this pandemic. You know, first and foremost, you're going to see a situation where we've got full emergency rooms treating COVID patients. So if you have any kind of complications from the flu, then you end up in the emergency room. You're going to be in a very vulnerable situation. And as I mentioned earlier, we've got two very, very similar viruses.
One of the most important reasons is that it's really hard to distinguish the difference between flu and COVID. The symptoms are extremely overlapping and similar, and so if you do get sick at home, sore throat, fever, muscle aches, you really don't know. There's no way for an individual to know whether it's a flu or whether it's COVID, and that worry and just the prevalence of disease leads to more ER visits, more hospitalizations, and really more strain on our healthcare systems.
A lot of people wonder if they can get both vaccines, if it's going to overload your system. That is not the case. We get multiple vaccines all the time, and they should come in at the end of August, beginning of September. Reporting live, Melissa Veitch, 13 ABC Action News. Back to you.
New details tonight about one of the 4 Toledo City Council members